Hello, this is Patrick, and I did my quantitative research on the return of bowel sounds, indicating the resolution of post-operative ileus. Is it time to seize this long-standing nursing tradition? And this is by Robert L. Mercy. So the study problem is auscultating for the return of bowel sounds, an appropriate indicating the resolution of post-operative ileus, a good assessment technique for the resolution of post-operative ileus. And so, what is post-operative ileus? PIO, which also stands for post-operative ileus, is a side effect of abdominal surgery. It usually occurs 3 to 5 days after abdominal surgery, and usually presents itself by signs like nausea, vomiting, abdominal distension, and it also increases the patient's hospital stay. Okay. And so, what's the aim of the study? The aim of the study is to analyze the differences in the duration of PIO, as indicated by time, of passage of the flatus in days between POI, as indicated by time of passage of flatus in days between the two groups. So, the second objective is to determine whether there's an association between the time bowel sounds are first heard and the passage of flatus. So research purpose is to determine if the return of bowel sounds is an unreliable assessment method to assess for the end of POI. And to determine whether there's a correlation between the first bowel sounds and the passage of the first flatus. Significance to nursing. Assessments in nursing are very important because they help the nurse to formulate the care plan and nursing diagnosis. So, is the escalating for bowel sound or assessing for bowel sounds, is it a reliable method to assess for resolution of POI? So more research is needed in this area. So framework and design of study. There was no theoretical framework or conceptual framework listed by the researcher. And however, he did use past ideas to help form his research. So research variables and interventions. The independent variable was the rocking chair intervention. The dependent variable was the return of bowel sounds or the passage of flatus. And the intervention was the rocking chairs. The sample size. There were 66 participants who participated in this research. 34 of them were in the experimental group. They received the rocking chair intervention, and 32 of them received the non-rocking chair intervention. Inclusion or exclusion criteria, excuse me. The patients who participated in this had to be patients who have about to undergo an abdominal surgery, and patients who have digestive cancer patients, and also patients who can speak fluent English, who are cognitively intact, who are able to ambulate from the bed to the chair, and who are able to sit in a chair or rocking chair, and also who are able to receive patient-controlled analgesics or epidural analgesics. And also, the researcher did not explicitly state an exclusion criteria, but it was implied. Legal and ethical issues. The researcher obtained consent from all the participants, informed consent before they participated. And also the researcher obtained approval to conduct the research from the University of Texas, Anderson Center for Cancer, Institutional Review Board. And the procedure and data. The control group received care that involved being ambulated from the bed to the chair 1 day post-off and receiving a non-rocking chair. And the experimental group involved receiving care, being ambulated from the bed to the chair 1 day post-off and sitting on a rocking chair. And the participants were assessed by the researcher, and the primary investigator escalated the bowel sounds, all the 4 quadrants of the bowel sounds for 5 minutes each. And he also documented all the data. He also he also obtained all the patient medical record prior to the procedure. And he only used the post-test only because you can only assess for the resolution of POI after the abdominal surgery. Results. There was no statistical difference between the time of the first bowel sounds between the rocking chair and the non-rocking chair group. The results confirmed previous studies that have been conducted in this area. So there's no significant there's no significant difference found in the correlation in the time of first flatus and the time of the bowel sound. There's no significant difference found in the correlation between the time of first flatus and the return of the bowel sounds. And escalation of bowel sounds should be used with caution with nurses. Limitations of the study. The researcher did not implicitly state any limitations. However, he used a very small sample size. Also, he emphasized that there's need for further research in this area, and also he did not consider any demographical differences in terms of age of the participants, because it might have affected the results. And also, he did not assess the different types of pain medications used by the participants. So that could have affected the results too. The nurses only escalated for the bowel sounds for only 1 minute instead of 5 minutes. That could have affected the results too. How the results affect nursing. Nurses should use caution when escalating, using as the return of bowel sounds to determine the resolution of the POI. And the nurses should use other reliable assessments to assess for resolution of POI, such as assessing for the resolution of symptoms such as nausea, vomiting. When the symptoms goes away, that means the POI has gone away too. And also the passage of first post-op flatus to assess. In conclusion, no correlation between flatus and return of bowel sounds, and no significant difference. There's no significant difference between the rocking chair group and the non-rocking chair group. And also, nurses must use the return of bowel sounds to assess for the resolution of PIO with caution, because it's not very accurate. And also, nurses should use a combination of assessments to determine the end of POI with caution. They should use a combination of assessment to determine the resolution of PIO, such as assessing for symptoms of resolution of symptoms to determine if POI has resolved. So, and this area needs further research. And in conclusion, this is my reference for the article that I used for the article by Robert L. Mercy. And thank you so much.